keep them from happening?
You do, and you got to be very careful what you use for tick products. There's a lot of them out there for dogs. There are very few out there for cats. Now, we're lucky that cats, Lyme disease has been reported a couple times, but it's pretty rare in cats. And so you want to be very, very careful, because a lot of the products that we use for ticks and dogs are toxic to cats, one of them being permethrin. You never, ever want to get that onto a cat as far as that goes. The thing about ticks are, the regular dog tick does not really cause Lyme disease. It can cause some other rickettsial diseases, but the deer tick, the black tick, is one that causes Lyme disease. And what people don't realize is that tick is just as active in the wintertime as it is in the summertime.
Oh, wow. Okay.
So it's the one tick that pretty much can bother us year round. So in that situation, Lyme disease, we don't see a lot of it in dogs, but if your dog is one of the 5% that can potentially get it, then you'll wish you had some prevention for that. But you're right, it is transmissible to humans through the tick. Lyme disease is not directly transmissible from dog to human. You need that tick bite in between, but it's out there. So, it only takes one bite to do that in these dogs and potentially cats.
Okay. How do you know if there's a tick on your dog other than just a visual inspection? Do they itch at it? Do they bite at it?
Now, ticks are sneaky little boogers, and they have a very slow process of penetrating the skin and so forth, so most of the time they do not cause itching. And if you've asked people that have had tick bites, they have no clue that the tick is even on them as far as that goes. The problem with the deer tick is that it's very small. You mentioned, how do we know our pets have ticks? You usually are petting them and you feel them or you see them, because most of these ticks are BB size or bigger. And the females, when they get engorged with a little bit of blood, I've seen some of them be the diameter of a dime almost, and so they get pretty good size.
Okay.
The darn deer tick is about the size of a flea and not much bigger. So they're very, very small, and they are the ones that actually cause the Lyme disease. And so it's difficult. So you really need to get some sort of preventative measure on there. And of course, we are fortunate, as we'll talk about a little bit later, to have a vaccine for prevention of Lyme disease in dogs. And that helps with it also. But I guess one of the things we need to talk about is, how do you know when to protect your dog and when not to?
Okay.
And so the bottom line is, if your dog has access to a wooded area, to a place with tall grass, if you do camping, if you do hiking with your dog, as far as that goes, you probably ought to consider preventative measures, either in the form of medication on the pet to prevent ticks from getting on them, or vaccination for Lyme disease as far as that goes. So.
Okay. When you see a tick, what should you do? I know there's all kinds of technique to removing a tick, but should you just leave it and call your vet right away? So that does seeing the tick help the vet diagnose anything?
You not initially, no, because it may take a while for that product, if the organism gets injected from the tick bite, then it may take a couple of weeks to show up on an antibody test or on a screening test, as far as that goes. So, and not all ticks carry that thing, but you don't want to take that chance. So you want to get it off as soon as you can, as far as that goes. So the easiest way to do it is, and there's varying opinions on whether or not to put a cotton swab with alcohol on it or not. Some people think that, insects breathe through their exoskeleton, so you may relax those mouth parts. But the key to this is you've got to get the mouth parts. If you don't, then they can still remain infective, and that area can get infected locally, as far as that goes. So the best way is to get either a good pair of tweezers or get a good pair of fine needle nose pliers. Or if you have hemostatic forceps, that's fine. Some people have those.
Okay. Just happen to have a pair in my other pants.
Heaven forbid. Some people may have them left over from high school, but I'm not going to go there. But anyway, you want to grasp that tick's head as close to the skin as you can, and you don't want to yank it out like you're starting a lawnmower or something like that. You want to put gentle tension on that and just gradually pull until you feel it let loose, and then pull it up and hold it up. If you've got a little area of skin, you've done good, because now you've got the mouth parts and everything.
Okay.
If you didn't get that little area of skin, you still want to clean that area with alcohol, and then again, you may want to contact your veterinarian. If you don't feel comfortable with it, you may want to just contact your veterinarian and let us take it off and go that route and see how we do.
Do you save it then? I mean, do you put it in a Ziploc bag? That's why I say, does you guys being able to visually see it, does that help at all to know what kind of tick it is?
It can help us tell what type of tick it is, and yes,
Okay.
whether it's a black tick or not, or you can take it over the OARDC, over the entomology
Okay.
department. They sometimes identify them for people. The health department will identify them, and then you can tell for sure, and they can even test to see if it's potentially carrying that. You know, we think about this Lyme disease as being in the upper New England states and so forth. There's a lot of it up in Maine, Connecticut, and that sort of up in Wisconsin, Minnesota, but it's coming our way. And bottom line is there are cells of these ticks that carry Lyme disease in southern Holmes and upper northern Coshocton County. There have definitely been cells of these ticks in there, and quite a few cases of Lyme disease in humans in Wayne County. A gentleman that's my barber now just got it, and he's been on antibiotics for the better part of 4 or 5 months, and had to get treated, outside of the state of Ohio because the specialists just don't seem to be in Ohio for this.
Okay. As far as prevention, we're going back to almost the same thing as fleas, right? We're talking the topical and the pill.
There is a pill there are 2 products that will help with ticks that are given orally. One of them is NexGard, the other one is Bravecto. I don't have any experience with Bravecto. It's a fairly new product. NexGard works by being absorbed and then diffused out through the skin continuously for about a month. So the bottom line is it can prevent ticks, it can kill ticks without them biting the animal. Bravecto requires a bite, and I'm a little leery of that, and I just haven't used that product as yet. The other products, of course, are the topical products. We use a product called Vectra, and again, permethrin is probably the premier topical product to be using on dogs for ticks. You never want to use permethrin on a cat, makes them seizure and die, so it's not a good thing to use on them as far as that goes. But the Vectra is a monthly topical, and it has activity against fleas and ticks both. As far as cats, our recommendation is Frontline works very well as a tick control on cats. It's very safe. I would say this, we used to use Frontline for years, and we had issues with it not working very well on fleas, and so we quit using it, but it is an excellent tick killing product, especially on cats. And we use a lot of Revolution on cats because it provides us with heartworm prevention for them also.
Oh, okay.
Revolution is not labeled for ticks in the cat, but it's labeled for ticks in the dog, and it's the exact same product. So we see very few ticks on cats that are treated also with Revolution. So.
Okay. Now I'm going to look at you thoughtfully and say, what is the zoonotic potential? Because I have no idea what that means.
Zoonotic potential.
Zoonotic. See, that was my first mistake. I
Zoonotic
mispronounced the
potential
word.
is how likely is this to be transmitted to humans? And yes, Lyme is a zoonotic disease. It's one of those, and zoonotic just means it can affect both dogs and people both as far as that goes. So we want to, again, we want to reiterate, it cannot be transmitted directly from the dog to the person, okay? But this tick can drop off your dog, or maybe not have attached to your dog. You're petting your dog, and all of a sudden it decides you look like a better free lunch, and so now the tick comes onto you. So it can be a reservoir for the ticks to get from the dog onto you, and in that way, that same tick can infect both your dog and you. So
I do several panorama shows, and I can always count on one guest that says, "Let's see how we can make him look stupid today." I'll put down words that I don't think he'll know, and zoonotic was definitely one of those. So well done, well played.
Yeah, thank you. I appreciate your help on that. So sometimes I don't need any help. So.
Okay. Next time, Dr. Yacoprero will be joining us.
Hey, I didn't bring a goldfish, so okay.
That's true.
Yeah.
That's true, and we want an update on Dr. Haverstock's fish.
It's
we
still
think
with
it
us.
ended up toilet bound, but we're not sure.
It's at his home, and his sons are taking care of it. So,
all right.
Yeah.
So we have a couple more diseases caused by ticks that are not thought of or easily recognizable for the host of a program to say. So,
well, one of them is anaplasmosis, and the other one is Ehrlichia. And I knew you were going to get those right, so I just jumped in ahead of you there.
Ehrlichia, I think I've had before. Is my dog has to go to the bathroom and wakes me up at 2 a.m. But
These are the same type of organisms that are similar to Lyme disease. They're rickettsial organisms. They're carried by ticks. Lyme disease, people want to know what the signs are. Well, the most common sign we see in dogs is joint lameness or fever and so forth. And if you suspect that, you can get a blood test in your office. We do a lot of routine screening now for these organisms also because of doing what we call the 4DX. We used to call it a heartworm test. Now we call it 4DX because we test for heartworms, we test for Lyme, we test for anaplasmosis, we test for Ehrlichia. And anaplasmosis and Ehrlichia are two organisms that they affect the blood cells. So they a lot of times cause anemia, and they also can cause thrombocytopenia, which that's a big word, but thrombocytes are what makes our blood clot. So they can make dogs become hemophiliacs as far as that goes. So those are the signs. We had a situation just this week where we had a dog that tested positive for Lyme disease. Small dog, really not hiking or anything like that, but they live at the end of Badorf Road and they have a little bit of woods by their house and so forth. And so, the dog was showing no clinical signs. So our in-office test is a screening. All it tells us is that the dog has been exposed to Lyme. It doesn't tell us whether it actually has it or not. And so we sent a second test off to the lab, and that's called a C6 antibody test. And we used 30. If the antibody response is less than 30, fine, the dog is fighting it off on its own, and 95% of the dogs have the ability to do that. Mm-hmm. But in this case, above 30, that dog has the potential to get full-blown Lyme disease. This little dog's C6 came back 280.
Wow.
So at that point in time, what do you do? How do you treat this? Well, we put them on doxycycline for 1 month, and that usually takes care of it, especially if we can catch it early. But one thing about Lyme disease that people don't realize is it generally has an affinity for connective tissue, joints, ligaments, that sort of thing. But it does sometimes go directly to the kidneys, and if you get Lyme that causes renal failure in a dog, you can't save them. They die.
Boy.
Yeah.
Okay.
So it can be acutely fatal. Usually not, but we have seen a couple of renal disease or renal kidney failure dogs from Lyme, and it's fatal all the time. You just can't save them. So anaplasmosis and Ehrlichia are more long-term if you don't catch it early. And so what we generally do is, again, ours is a screening test. It just tells us that the pet has been exposed to it. We do some blood smears, send them off to the lab and do a complete blood count. If they're not anemic and the blood smears are clean, fine. They've been exposed to it, but they don't have it. But there are just some nasty things out there. And one that we didn't talk about that dogs can get is, and people also, is Rocky Mountain spotted fever. That's usually seen more out west. So ticks are just nasty little critters. Few things in veterinary medicine give me the heebie-jeebies, but that's one of them.
Ticks will do it. Going to have our camera person Gertrude get a shot of the jar real quick. Because we're running out of time, Greg. We've only got about a minute or so left.
Okay.
I don't think we need to talk about this a lot, but I just want people to see this because these are heartworms, folks, and they can grow in your dog from a mosquito bite, a simple mosquito bite. There has to be some factors in that mosquito bite, but this is why you need to get your dog on heartworm prevention, and cat, for that matter. See those spaghetti-like things? Those are the heartworms.
That's like hair in a drain, and they clog up the heart and so forth. The bottom line is get to your veterinarian and talk to them about prevention. There's a new injectable 6-month prevention out there that can be given by an injection. The bottom line in this area is you should be on heartworm year-round. We have seen 2 positives already this year.
Okay, and it is transmitted by mosquitoes.
That is correct. Anytime there's a chance of a mosquito bite, there's a chance of getting heartworms. And this one dog that we treated already this year was about a 13-pound miniature pincher. So
wow. Okay, so heartworm, definitely dangerous stuff. Again, we've talked about it several times. So please, please, please do the heartworm prevention, and as well as the fleas and ticks as well. And if you have any questions, you can certainly contact your veterinarian, or you may contact the Worcester Animal Clinic, worcesteranimalclinic.com, or you may call them at 330-262-3336. And